In September 2013, residents of St. Vincent and the Grenadines saw the completion of the first ever smart healthcare facility in the region, the Georgetown Smart Hospital. The SMART standards allow for a combination of resiliency and environmentally sound components within a health facility to promote reduced operating costs, improved safety, environmentally sound operations, reduced downtime, resilient structures, and improved services for the community. Safe plus green equals smart. Since the completion of the works at the Georgetown Smart Hospital, there has been significant savings in water and energy consumption, and the facility has been able to operate more efficiently, allowing for increased usage by residents within the surrounding communities. 2 years later, Phase 2 of the Smart Healthcare Facilities in the Caribbean project commenced and is being implemented in St. Vincent and the Grenadines, Grenada, St. Lucia, Dominica, Jamaica, Guyana, and Belize, over a 5-year period ending June 2020. The Smart Healthcare Facilities in the Caribbean project is financially supported by the United Kingdom's Department of International Development, DFID, in the amount of £38.3 million and implemented through the Pan American Health Organization Emergency Preparedness and Disaster Relief Department, in partnership with the Ministries of Health in the target countries. 8 priority health facilities have been selected for retrofitting in St. Vincent and the Grenadines as part of the Smart Healthcare Facilities in the Caribbean project, to include Barley Health Center, Georgetown Clinic, Stubbs Polyclinic, Clifton Hospital on the Grenadine Island of Union, Port Elizabeth Health Center on Beckway, Myro Clinic, and Sandy Bay Clinic. The Chateaubelair Hospital and Health Center will also be retrofitted and has been selected as the showcase facility. The Chateaubelair Hospital and Health Center was built in 1980 and is a 19-bed facility that provides direct medical services to approximately 8,240 persons. It offers an average of 400 consultations and up to 24 admissions per month and is served by 24 members of staff. The compound includes approximately 1.66 acres of land and consists of 4 buildings that provide for living quarters and a 2-story building that includes the hospital on the 2nd floor and the clinic and HIV section on the 1st floor. Supplies at the facility are limited, and there is an obvious need for replacement and additional supplies and equipment to support the operations of the facility and to serve the larger catchment area. Access for the disabled needs to be enhanced, and air quality in workspaces needs to be improved. Considering the age of the building, the electrical and plumbing will have to be updated, and so it is expected that the current fixtures are not compliant with local norms and regulations. Majority of the fixtures are either damaged or deteriorated. The roof is constructed of reinforced concrete, but there are large cracks in beams and the concrete roof is leaking. The property has no defined parking spaces for staff or visitors. A landing bay is designated for the single ambulance. However, this location is also used by persons visiting or awaiting health care. The Chateaubelair Hospital has no functioning fire extinguishers. Most exterior doors need to be replaced with fire-rated doors and emergency locking mechanisms. Drainage is also a concern for the area, but there is strong evidence that with some investment, the Chateaubelair Hospital and Health Center has the potential to meet the SMART standards. On October 21st, members of the Chateaubelair community gathered at the Learning Resource Center for a town hall meeting to discuss the plans for the hospital and clinic. More than 80 persons were in attendance, along with a number of key government officials. The works proposed for this health facility will include replacement of windows and doors, increased workspace, increased water storage, and improved drainage and security. There is potential for energy savings with the installation of a photovoltaic system and LED bulbs, as well as improved cooling systems. Installation of solar water heaters will be incorporated, as well as a full upgrade to plumbing and electrical systems. Efforts will be made to offer better security for patients and staff, especially for those who reside on the compound. The generator at the facility can only power a few lamps, and fuel storage is very limited. Therefore, a unit that is suited to the operations and size of the facility will be procured and installed. Since the project has started, PAHO has supported the facility in developing a comprehensive disaster management plan as well as an energy and conservation guide for the facility. It is expected that the change will be significant and the residents of the Chateaubelair area will enjoy a safe, healthy and green facility. Keep watching as we transform the Chateaubelair Hospital and Clinic to a smart healthcare facility.